Welcome back, everyone, to The Deep Dive. This is your weekly digital health program, and we're brought to you by White Coat Hackers Media. It really is great to have you with us again as we, explore what's happening in this field. Our mission is, well, pretty straightforward. We look at the latest developments, the news, the research, all the source material coming out of digital health, and we try to unpack it. We want to make sense of it all, make it understandable, relevant for you, no matter your background.
Exactly. We're sort of guides navigating this constantly changing landscape. We try to pull out the key things, the shifts that really matter, and, the innovations that might genuinely impact healthcare.
And today, we've got a really compelling mix in our sources. We're going to start by digging into the foundations. What happens when the digital plumbing, so to speak, has issues.
Oh, yeah. That's crucial.
Then we'll pivot. We'll look at how digital health partnerships are trying to tackle a huge health trend, managing GLP-1 medications.
Something everyone's talking about.
Right. And after that, some really genuinely exciting stuff with AI in diagnosis, how it's helping more than just the specialists.
That's a fascinating area.
And finally, we'll broaden out, see how AI solutions are expanding globally into new areas like pregnancy care, kidney screening, things like that.
So it's quite a journey from the hidden infrastructure right up to specific clinical tools impacting people worldwide.
It really is. And we have to start with that foundation piece because, as digital health gets more complex using AI and all these advanced tools, it all relies on that basic infrastructure. And sometimes it wobbles.
It definitely can. And our sources highlighted a recent event that was a pretty stark reminder of just how dependent we are.
Okay, let's get into this then. There was a significant global outage just last Thursday. Not a small thing. It hit Google Cloud Services specifically.
That's right. The source material confirms it was global, and it lasted nearly 4 hours, which is quite a while.
4 hours globally? For a major cloud provider? That feels... it's substantial. And it wasn't just general stuff, was it? It hit specific AI tools used in healthcare.
Exactly. The sources list things like Vertex AI, Dialogflow CX, Agent Assist, Contact Center AI. These were directly disrupted.
And these aren't just, background processes. They're actively used.
Oh, absolutely. They're embedded in patient care, clinical workflows, admin tasks.
Okay, so break that down for us. What are these tools actually doing in a healthcare setting that makes an outage like this matter?
Good question. So take Vertex AI. That's a big machine learning platform. Hospitals and health systems use it for, all sorts of things. Helping analyze medical images, maybe predicting patient risks, personalizing treatment recommendations based on lots of data, even optimizing how the hospital runs. So if your system uses AI to quickly flag potential issues on a scan, say, that capability just went offline.
Right. So it's actually part of the clinical decision support or the operational flow. What about Dialogflow CX and Agent Assist?
Those are often about streamlining things, interactions, workflows. The sources mention clinical support, admin tasks. So think maybe automating parts of documentation for doctors or handling patient questions with chatbots or managing scheduling processes more automatically.
Okay, so hitting both the clinical side and the sort of back office stuff and contact center AI. That one sounds pretty patient-facing.
It really is. That's heavily involved in patient engagement, automated appointment booking, handling billing queries, maybe that initial triage through a virtual assistant.
Digital front door people talk about.
Exactly that. So when that goes down...
patients feel it directly.
Trying
to book, trying to get answers. Just hitting a wall.
Absolutely. It immediately impacts patient access, the whole patient experience. It just shows how deeply these, digital foundations are woven into delivering care now. And just to show the scale, it wasn't just healthcare affected. The sources mentioned big names like Spotify, Cloudflare, Snapchat, Discord. They were hit too.
Wow.
It really shows how much of our digital lives, including critical stuff like healthcare, relies on just a few key infrastructure layers.
That really drives it home. What was the official word from Google, according to the sources? What was the status?
Well, the technical update said they'd found the root cause, applied fixes, mitigations, and at the time the source material came out, recovery was happening in most places globally. But they specifically called out the US Central 1 region and some multi-region setups affecting the U.S. as still having problems.
So not fully resolved, especially in a key U.S. region. Did they give any timeline, an ETA for getting everything back up?
No, and that's tough, right? The update just said engineers were working on it for those specific areas, but No estimated time for full restoration.
Oof, no estimated time is not what you want to hear if you're relying on these tools for, diagnostics or patient scheduling. So what does this mean for you, the listener, when you think about the healthcare services you might use?
I think it really underscores the inherent vulnerability that comes with this increased reliance on cloud AI and digital systems. As healthcare integrates these tools more and more, the reliability, the redundancy of those underlying systems, it becomes absolutely critical. This wasn't just a tech glitch. It showed how fast digital health services and therefore patient care and access can be disrupted if that foundation falters. It's a huge challenge the industry has to keep tackling.
Yeah. A powerful reminder that even the smartest AI still depends on physical stuff, data centers, cables, networks. Okay, let's shift gears completely, moving from infrastructure worries to how digital health is tackling a specific and frankly massive health trend. The rise of GLP-1 medications. Our sources point to a new partnership aimed at managing this.
Yeah, this involves LucyRx, which is a pharmacy benefits manager, a PBM. They handle drug benefits for employers. And Personify Health, which focuses more on health navigation, wellness programs, that sort of thing.
Okay, so a PBM and a health navigation company joining forces. What's the main goal here?
Yeah. Their stated aim from the source is to give employers a more personalized, more clinically focused way to manage GLP-1 use and overall weight care. It's about moving beyond just, approving or denying the prescription.
Right. More tailored, clinically driven. How does it actually work? What's in this integrated offering?
Well, it's designed to combine that pharmacy benefit strategy side with really comprehensive patient support, pulling strengths from both companies.
And what are the specific pieces of that support? What do the sources list?
Okay, so from Personify Health, using their Transform Weight Management program, you get personalized coaching, actual guidance, and counseling, plus personalized care plans, education specifically on managing the medication itself effectively.
So human support and education wrapped around the drug therapy. Makes sense.
Exactly. Then on the LucyRx side, they bring in their AI platform, LucyIQ. This helps them implement targeted prior authorization criteria.
Prior authorization, right. That's the hurdle where the benefit manager has to okay the script before it's covered.
Yeah. And the source stresses this criteria is targeted. The idea is to use AI to help make sure the therapy gets to the patients who truly need it most, based on clinical factors. They also use LucyIQ for real-time clinical reviews and optimizing the benefit for the patient.
So the AI is kind of helping streamline getting the right people approved.
That seems to be the goal. The partnership also adds other layers of support, things like specific care pathways for menopause.
Oh, interesting addition.
Yeah, and behavioral health support, both from LucyRx. And the strategy also includes what they call orderly step-down rules.
Step-down rules, like helping people taper off.
Presumably, yeah. Helping patients transition or maybe stop the medication in a structured way if it's clinically appropriate, aiming for better long-term outcomes, not just short-term use.
That sounds quite holistic. Drug management, AI for targeting, coaching, behavioral support, specific pathways. Seems important for chronic condition meds.
Definitely.
And the scale they're planning for here is...
Oh, it's huge, isn't it? It really is. The source quotes Dr. Jeffrey Jacques from Personify Health, and he references J.P. Morgan research. The projection is that around 9% of the U.S. population, that's roughly 30 million people, could be on GLP-1s by 2030.
Wow, 30 million people in just about 6 years. That's a massive chunk of the population.
Yeah.
So for you, the listener, if you or someone you know uses or is thinking about GLP-1s, or if your insurance comes through work, this partnership is an example of how companies are using digital tools, AI, and support programs to try and manage the costs and the complex care needed for this rapidly growing group.
Yeah, it really highlights that need for digital solutions that go beyond just filling scripts. It's about integrating that full support package for chronic conditions at scale using data.
Absolutely. Okay, now for something a bit different but equally exciting, AI breakthroughs in diagnosis. We often hear about AI helping specialists, right? But what if it could really boost diagnostic accuracy for non-specialists, too?
Well, this is where a new AI model called PanDerm comes in, developed by an international team led by experts from Monash University in Australia.
PanDerm. Okay, sounds like it covers skin conditions broadly. What's the big innovation?
It's a good name for it. The key innovation highlighted in the source is that it's a multimodal foundation model.
Multimodal meaning?
Meaning it's built to analyze multiple different types of skin images all at the same time, simultaneously. That's the really crucial part.
Okay, different types of images. Like what?
The sources list things like regular close-up photos, dermoscopic images, those magnified views,
Yeah.
pathology slides from biopsies, and even total body photos. Being able to pull insights from all of those together is what makes it different.
That sounds way more powerful than just looking at one image type.
Yeah.
How is it trained? What must have needed a lot of data.
A huge amount, over 2 million skin images. And they came from 11 different institutions in various countries, so big-scale, diverse data. Important for making it robust.
And was it trained just to spot one thing, like melanoma?
No, much broader. It was trained for a whole range of clinical tasks. Things like assessing total body skin cancer risk, predicting if cancer might come back or spread, looking at skin type, counting moles, tracking how lesions change, even helping with differential diagnosis for various conditions. It's meant to be really versatile.
Wow. Okay, so a comprehensive skin AI. The study results, published in Nature Medicine, which is a top journal, sound pretty impressive.
They really are quite remarkable. One of the big headlines: the model actually did better than human clinicians at detecting early-stage melanoma by 10%.
Outperformed humans on early melanoma detection.
Yeah.
That's huge. Early detection is everything with melanoma.
It really is significant. And it also helped dermatologists. The study showed it increased their accuracy when looking at dermoscopic images by 11 percentage points, boosted them up to 80% accuracy.
No. So it's not just about replacing the experts, it can actually make them better too.
Exactly. But here's the bit that really speaks to that non-specialist angle we started with. The study found PanDerm significantly improved the ability of non-dermatologists to identify and tell apart various skin conditions like inflammatory issues, pigment problems, just from standard photos.
How significant an improvement?
A really substantial 16.5% improvement.
16.5% better for non-specialists? Wow. Who exactly are these non-dermatologists they tested?
The source lists general practitioners, your family doctor, general medicine practitioners, nurses, and even clinical trial assistants. Basically, the frontline healthcare workers you often see first.
Okay. So making them better at spotting things has enormous implications for access, doesn't it? It could mean your regular checkup with your GP or nurse becomes a much more effective first screen for skin problems. Maybe fewer unnecessary specialist referrals or catching things earlier.
Precisely. It suggests AI could help bridge that gap, where maybe you don't have easy access to a dermatologist. It could lead to earlier detection, better initial management. The study also mentioned PanDerm did better than older AI models, sometimes even using less data, which hints it might be more efficient too.
Which could make it easier to roll out more widely. So connecting this back to you, the listener, think about your next physical or visit to the nurse's clinic. This research suggests AI isn't just some futuristic tool for specialists. It could empower the everyday healthcare providers you see to be much more accurate in spotting potential skin issues right there and then.
Yeah, it really demonstrates that potential for AI to push diagnostic power out to the front lines, to the first point of contact.
Okay, building on that idea of AI reaching further, let's look at a couple more quick examples from the sources. They show AI expanding geographically and into new screening areas.
Right. First up, we see pregnancy care AI solutions moving into Southeast Asia.
Okay, who's involved in this?
This is an Indian startup called Dodo Health. They use the brand name CareMother, and they've partnered with FHI 360, which is a big international development organization, and also Alive and Thrive, a global nutrition initiative.
And where specifically are they expanding?
They've signed agreements directly with the health departments in Quang Tri province in Vietnam and also Savannakhet and Salavan provinces in Laos.
So working directly with local government health bodies, what's the main goal in these specific areas?
The core aim is to use digital health tools to tackle maternal and infant mortality challenges, particularly focusing on underserved areas within those provinces.
Using digital tools for critical global health issues. Did they mention any specific technology?
Yes. The source highlights they did a demonstration of an AI-powered wireless fetal monitor. This was at a district hospital in Vietnam.
An AI-powered fetal monitor. How does the AI help in that kind of setting?
Well, by adding AI, these tools can offer point-of-care diagnostics, getting important insights right there with the patient. They also support remote monitoring, which is obviously huge in areas where getting to a clinic is hard. And they help healthcare providers make better data-driven decisions about managing the pregnancy, identifying risks earlier, perhaps.
That feels like a really impactful application of AI improving maternal and infant health in places with fewer resources.
Absolutely. It's a great example.
And the second example of AI's expanding reach. A new screening tool approved in South Korea.
Right. This one comes from a medical AI company called VUNO, and the product is named DeepEdge Kidney.
DeepEdge Kidney. So using ECG data, the heart trace, to look at kidneys, is that right?
Exactly. It's AI software that analyzes a standard 12-lead ECG, a very common test using deep learning. And its purpose is to screen, non-invasively, for potential kidney failure, which can indicate chronic kidney disease.
Wow. Taking a standard heart test and using AI to pull out data about kidney health, that's really clever. Is it a first?
The source says it's the first locally developed tool of its kind to get approval from the South Korean Ministry of Food and Drug Safety. So yeah, significant regulatory step for them there.
First, local approval. How accurate is it, did they say?
Yeah, a clinical study mentioned in the source showed it achieved up to 85% accuracy for screening.
85% accuracy from a non-invasive screen using a standard test. That's pretty promising. Is this VUNO's only ECG-based AI tool?
No, actually, it fits into a bigger picture. DeepEdge Kidney is their fourth ECG analysis product to get regulatory clearance in South Korea. They already have approvals for tools that screen for things like heart attack risk, heart function issues, even high potassium levels, all from ECG data.
So they're building a whole platform of AI insights from that one common test. Are they planning to make it more accessible too?
Yes, VUNO said they plan to link this DeepEdge Kidney software and their other ECG tools to a portable ECG device they make called the HATV P30.
Linking it to a portable device that could take this screening outside the clinic, right? Community centers, maybe even homes eventually.
Exactly. It massively boosts the potential accessibility, making it easier to use at different points of care, maybe even outside traditional settings altogether.
So wrapping these examples up for you, the listener, they really show how digital health AI isn't just staying in one place. It's moving into new parts of the world, like Southeast Asia, to tackle big health challenges like maternal mortality. And it's finding really ingenious new uses, like taking a common test like an ECG and using it to screen non-invasively for something totally different, like kidney disease. It shows that constant drive to make diagnosis and monitoring easier, more accessible, more integrated.
Yeah, it's really inspiring to see these technologies being adapted for such different needs in places around the globe.
This has been a really packed deep dive today. We covered quite a bit. We started with that crucial reminder about digital infrastructure, how important its resilience is, highlighted by that Google Cloud outage affecting healthcare AI tools.
And we saw how partnerships are forming to tackle huge trends, like managing GLP-1s by combining pharmacy strategy with real comprehensive patient support, often AI-driven.
Then we got into those really exciting AI diagnostic breakthroughs, like PanDerm for skin conditions, showing amazing potential not just for specialists, but significantly boosting accuracy for GPs and nurses, too.
Yeah, that was striking. And finally, we looked at AI expanding its reach globally into maternal health in Southeast Asia and finding new applications like non-invasive kidney screening using ECGs in South Korea.
It's just so clear that digital health is constantly evolving, isn't it?
Yeah.
It's touching healthcare in so many different ways, from the plumbing right up to these super specific tools and global initiatives.
The pace really is incredible. It's hard to keep up sometimes.
Well, thank you for joining us to try and make sense of it all on this deep dive.
Always a pleasure to explore these developments.
And before we sign off, here's that final thought for you to chew on. It comes back to that PanDerm AI for skin conditions. If AI can make your GP or nurse significantly better at spotting potential skin issues just from a photo during a routine visit, how might that change the role of your primary care provider in the future? Could these AI tools turn your regular checkup into a much more powerful first line of defense for a whole lot more conditions? Something to think about as digital health keeps weaving itself into the fabric of everyday care. We'll see you next time on The Deep Dive.